Hello everybody. Today I am going to put a focus on how the COVID-19 positive patient can be transferred from one place to another, whether it can be an inter-hospital transfer, intra-hospital transfer, and transferring the patient from the primary primary care facility and the community setting. In order to going forward, I would like to request you please do like, share and subscribe my channel. Okay, actually the COVID-19 positive patient can be transferred in a three different way. First is the intra-hospital transfer. Transferring the patient or moving the patient from a single room or a coherent area should be limited to the essential purpose only. The service that are waiting in the receiving destination must be informed that the patient that is being transferred may have or suspected to have a COVID-19. Okay, also if the patient must be transferred from one place to another, it is very important that the patient must be provided with a water resistant surgical masks. Okay, so in order to avoid the expulsion of the respiratory droplets, and patient must wearing it whether during the transportation. Okay, number three is that it's very important to provide the patient with rubber or hand gloves. Patient must run over the hand in order to avoid the contamination of any object that is present in the vicinity of the patient. Also, it is very important to take the patient straight and return from the clinical area, and must not wait in that communal area for a long period of time in order to avoid the spread of the disease. Also, if possible, it is important to put the patient at the in the last clinical list. Okay, now the second way of transferring the patient of particularly the COVID positive patient is the transferring the patient from the primary care facility or a communal setting. Okay, so if required, the patient can be transferred from the primary care or a communal setting to the hospital, and it is very important to inform the ambulance service about the infection status of the patient. It is also important to the transferring rooms or the hospital area or the hospital department is that the patient that is going to be transferred in their department can have a coronavirus or can be a COVID-19 positive. Okay, and the third way of transferring the patient is a inter-hospital transfer. So the inter-hospital transfer, that is transferring the patient from one healthcare facility to the other healthcare facility, should be avoided. Okay, transfer may be undertaken for the medical necessity for the specialist care if the patient required concurrent to the medical condition or the medical event of the patient. For example, if the patient requires a dialysis or a cardiac angiography can be performed. And it is also important that to inform all the staffs of the hospital and the department that the patient is going to transfer to their department in the hospital, and special precautions must be taken place in because the patient have a possibility that he can having a coronavirus or a COVID-19. So this is all about the how the patient can be transferred.